Claire, it's 12 now. You can start.
Thank you, Elizabeth. Elizabeth Morin is Canadian Nurses Association staff member and is the technical wizard here with us. So I'm hoping everybody can hear me and that the sound is okay. My name is Claire Betker, and I am the president of the Canadian Nurses Association, and I'm talking to you from my home in Winnipeg, Manitoba, and it's snowing here on April the 3rd, and our river is high. So those are some of the things, other things, of course, that are on my mind as I look out the window here today. But I do have my coffee, and anybody who knows me knows that I love coffee, and it's an important part of my life. So I'm really, really happy and really privileged to be here with you today for the first in our series of webinars, as we're calling them, Coffee with Claire. And there is a coffee, if you Google that, there is a Coffee with Claire out there. I think her name is Claire Coffee. Anyway, as I said, I'm the president of the Canadian Nurses Association, and I will be that until the end of June 2020. And at that time, Tim Guest from Nova Scotia will take the reins as your president of the Canadian Nurses Association. It has been a distinct privilege and pleasure and an incredible opportunity, professional opportunity, to act as president-elect and now as president of the Canadian Nurses Association. And I'm a long-standing registered nurse in, as I said, in Winnipeg, Manitoba, and I've spent my entire career in the community, and the majority of that in public health. So it's a very interesting time that in my presidency, we would have the biggest public health crisis in our lifetime for sure, but actually in more than a century. So I'm really happy that you're here with us today. I'm just going to give a little bit of the technical goings on. There is a chat box. If you look at the bottom of your screen down there, it says chat, and it also says Q&A. So we're hoping that you will right now, as I'm introducing myself, will introduce yourselves to not only to us, but also to those of you that are on the line. We're hoping that we will have some exchange and sharing of information, sharing of resources, sharing of questions, maybe even answering of the questions. So use that chat box, please. In the Q&A box, if you could put in there your questions, and I will do my best to answer the questions today, but we're going to use those questions as we go forward in a series of webinars that we're scheduling every Friday, except for next week because it's Good Friday, so we'll have it at noon hour Eastern time, so 12 noon Eastern time, so that we can accommodate those 6 time zones across our great country. And but next week we'll have it at Thursday. So in those webinars, as we move forward, we will do our very best to provide you with answers to those questions, and we will have panelists and speakers and other people with us. Today, there's just me here, and there's a number of people online, and you're doing a great job. I can see you there, and I can see many of my friends and colleagues typing in there. So keep going with that chat box, please. So I'm going to just ask Josette Roussel. She's a senior staff member at the Canadian Nurses Association, just to do some introductory comments in French for those of you that are online and are French speaking. So Josette, I'm going to ask you to speak now.
Bonjour à tous les participants et merci à Madame Becker qui est notre présidente. Nous sommes très contents de voir l'intérêt et puis toute la participation à ce webinaire aujourd'hui. Et puis, comme il a été mentionné par notre présidente, nous allons répondre aux questions des participants en français et nous invitons les participants à mettre la question sur le Q&A, la boîte qui va être en dessous de votre écran, et nous répondrons à vos questions à mesure qu'elles sont posées. Et si on manque de temps, on va vous répondre après le webinaire. Alors, Je laisse la parole à notre présidente et je vous remercie énormément de votre participation et j'espère que vous avez trouvé cette présentation intéressante et utile. Merci.
Thank you, Josette. And there are other French speakers online. I can see some of them. So please, if you want to ask your question in French, please feel free to do so. Either in the Q&A is where the questions go, but feel free to chat in that chat box. So often in a webinar, there's a formal presentation, there's slides, there's different speakers, and we come together and we have a chance to chat in the box and to ask questions. And in some ways, this format today is kind of turning that on its ear, if you will, a little bit, and saying, let's open those lines, let's open that conversation, let's talk to each other. It's almost like we're hosting a bit of an unwebinar, if you will. So I'm going to make some opening comments, and then we're going to open the questions in the chat box. So I know you know that the World Health Organization declared COVID-19 pandemic on March 11th. And what was really interesting for us at the Canadian Nurses Association, we were just finishing up right then our board meeting, our March board meeting, and actually Michael Villeneuve, who's online there, our esteemed Chief Executive Officer of the Canadian Nurses Association, was also meeting with the executive directors and the CEOs. And as I walked back through the Ottawa airport that day on March 11th, I thought to myself, you know, I don't think you're going to be traveling, and just had that sort of heavy feeling. And wow, really, March 11th, we're not yet a month, but really what happened since then is we are facing the largest public health emergency since the Spanish flu, which was over a century ago. And the significant impact of coronavirus in really a few short weeks to our country, to our world, to our work, to our economy, and to our lives really is truly staggering, and something I don't think we could ever have imagined, planned for, or anticipated. And as nurses, we, all of us, are playing a critical role in the response to COVID-19. And I must say, despite the increasing challenges with the healthcare system that the health system is facing, nurses show up, continue to show up, willing and ready to take care of the public during these very, very difficult times. And I just want to acknowledge that actually two of our children are registered nurses, and they each sent me a photo this morning of them at testing centers in their hospitals with their masks on. So I want to take a moment to thank all of the nurses. So licensed practical nurses, or registered practical nurses as they're called in Ontario, registered psychiatric nurses, nurse practitioners, and registered nurses all across our country, coast to coast to coast, and we number over 430,000 nurses in Canada. And I just want to say thank you. I want to say that I have never been more proud to say that I am a nurse, and I stand to be counted in that 430,000 plus nurses. But I really also want to thank all those nurses for the knowledge, for the skill, for the science, for the leadership, and for the caring that they are providing and that they will provide in the coming weeks and months. And we've had a very distinct privilege at the Canadian Nurses Association, and we've opened that up to our board, and those recordings are on our website, the Canadian Nurses Association website, to be on webinars with the International Council of Nurses. And there are 20 million nurses globally. So it really is staggering is really the only word I can think of, that the enormity of that response and the enormity of what's going on out there. So to provide our members within Canada with current reliable information on COVID-19, we decided to host these webinars. And as I said, we'll host them weekly. And the genesis, I think, of them was a desire on the part of the team at CNA to sort of answer that call and to be there and supporting our members and nurses across the country. But I must say for myself, I've actually done way more media than I anticipated doing in my presidency or probably ever in my career. And I get asked the question as the spokesperson for the Canadian Nurses Association, what are you hearing from nurses? And I was feeling somewhat uncomfortable that I really couldn't answer that question with honesty and integrity. And so we thought by having some way of dialoguing, some way of having a conversation with each other, that we would be able to sort of collate, if you will, or lift up those that information and those questions and your voices. So CNA is the voice for nurses, both nationally and globally, of Canadian nurses. And we truly are committed to being that voice in this period of time. So the Canadian Nurses Association has been advocating, you need to know that, all levels of government to ensure that our members and all nurses, especially right now around the personal protective equipment, have all the supplies and information necessary to respond to the COVID-19 safely and to protect themselves and their colleagues and the people that they're working with and caring for. And in that media, I'm always try to make the point that nurses work in many, many settings across the whole continuum of our health system, including on the streets, in communities, in shelters, in hospitals, long-term care facilities, nursing stations, community health centers, home care, and also in terms of palliation and supporting people at home. And people's health issues are not only focused and isolated to COVID-19, although that's very front and center, but there are many other things going on, and we continue to address those needs. But another really, really important role that I see for nurses in our country and globally is we are seen and trusted, and we're seen as that source of trusted information. And I know each and every one of you, I'm sure, are getting questions, as am I, around very personal things. And so what we want to do at the Canadian Nurses Association is keep you informed. Try to point you to that best evidence, to where there's the best information, so that you can actually respond to whether it's family, whether it's a school parent council member, or whether it's a neighbor, or whether it's a community member that, or a social service provider. We're hearing about people on the street and in outreach type of work where they are also concerned about their personal protection and their own safety and wanting to have the best information on personal protective equipment. So sort of over the next few minutes, then I'm going to just highlight very high level what CNA is currently doing. And then I'm going to open the conversation to you and to us. We have some people on that can speak, and so we'll see how that goes, and trust that it's going to meet your needs and work for us. So as I said, first and foremost, at the Canadian Nurses Association, we are concerned, very, very concerned about the protection of nurses. And as the largest group, I think globally this morning, the ICN said more than 60% of the healthcare workforce globally are nurses. As the largest group of healthcare professionals in Canada, we really are a mighty force, and we are responding to this public health emergency. But we do need to be protected. We do need to make evidence-informed decisions. We need to have the equipment, the supplies at our ready, and they need to be there with clear, consistent guidance that people are comfortable and can trust and can work from. And we know that there's debate, and we know that there's different information out there, and CNA has a long history of having strong positions and working from evidence-informed decision-making. And so we at the Canadian Nurses Association, Michael and the team in particular, have been at the table with the Public Health Agency of Canada. We're in communication with ICN, and from them to the World Health Organization, and are really looking and asking them for that clear, consistent guidance and information. And we're certainly urging all levels of government that when they're unsure, to actually err on the side of safety and protection, and to provide the supplies and equipment that is required for that. We've written letters, those are on our website, to both the Health Minister, Minister Hadju, and also to the Prime Minister and to the First Ministers in all the provinces and territories. We've written those letters in collaboration with the Canadian Federation of Nursing Unions, and we thank Linda Silas for her and their board and leadership, and for coming on side with us in that letter. And we've also written the second letter in partnership with the Canadian Medical Association, the Canadian Association of Social Workers, the Canadian Indigenous Nurses Association, and the Canadian Association of Pharmacists. So we're standing also in solidarity with our interdisciplinary team. And I know Mike just this morning was talking to the representative from the Canadian Medical Association. So the choice about equipment used in clinical situations in hospitals really needs to be made by the provider, and we acknowledge and have promoted that nurses, as well as the members of the interprofessional team, have the knowledge, they have the science, they have the skill to make those decisions for themselves, and they need to be empowered, and they need to have the information and equipment and supplies there to be able to do that. So we encourage people to seek out that expertise and continue to ask us questions about that, and we will continue to keep, as ICN said this morning, at a global level, that foot on the pedal there, and we will continue to keep our foot on the pedal within Canada. So there's been 3 webinars, as I said, that have been hosted by the International Council of Nurses. Annette Kennedy is the president right now. She's from Ireland. Howard Catton is the CEO. I would encourage you to go to their website. There's links on it through our website, and some of their information is really, I think, helpful, especially the information coming from the countries who've gone before us in this: China, Spain, Italy, and we're certainly learning from there. And one of the things that is coming up, and it may be something that you would like us to host a whole one of these webinars on, is the ethical considerations, and the ethical considerations in multi-levels and in sort of with multi-dimension. And so if you'd like that, please type in that chat box or suggest speakers or suggest resources to that. So CNA updated their Code of Ethics in 2017, and it states that during a natural or human-made disaster, including a communicable disease outbreak, nurses provide care using appropriate safety precautions in accordance with legislation, with regulations and guidelines provided by government, by regulatory bodies, and I see that some of our regulatory bodies, our associations, our colleges are online, and I thank you for joining us today. Employers play an incredible role here, unions and professional associations. So that's what the Code of Ethics says right now. And it also provides specific guidance and ethical consideration for nurses who may be experiencing unreasonable burdens, and it also can provide support as we develop risk mitigation strategies. And I was thinking about those ethical considerations and looking last night online and found actually an excellent resource put out and updated just on March the 28th with a ethical decision-making framework, and it's put out by the British Columbia BC Centre for Disease Control. So it's very specific to COVID-19, to the pandemic, and it's really providing ethical analysis and advice really to healthcare workers as they strive to provide care. So talk to us in the chat box about that, and we can certainly consider having some experts. And I actually saw some of the names of who I might identify in Canada as being able to provide ethical considerations for nurses. And I think that would be a very interesting webinar to host either next week or after that. Another area of concern, there's a couple that CNA has been thinking about and working hard on, and that's around the mental health of nurses and of our colleagues during this time. And we are concerned about the emotional and psychological impacts of COVID-19. And we have advocated again to the federal government to be thinking about that, but to think about it not only in terms of the response and right now, but also to think about it in the long term. And many of you I know have been involved in emergency preparedness and response, and often a very neglected area in planning is thinking about that recovery. And I've been involved in a number of outbreaks and a number of natural disasters and responses in the province of Manitoba. And, you know, we really had to push hard to think about that recovery. So I think we need to think about mental health and the psychological well-being of nurses, not only right now in the response, but also as we go forward. And I know there's lessons to be learned from those of you who are involved in SARS, who are involved in H1N1 on the way forward. So at CNA, we're working very closely with our national, provincial, and territorial nursing counterparts to identify support services that are accessible and are tailored specifically for nurses, because we are playing a very, very essential, but I think also a unique role in this situation. And you'll start to see links, I think, appear on our provincial counterparts' websites, pointing to some of those good resources to be thinking about and to be using, as well as we'll be sharing them on CNA's social media as well as on the website. And CNA, the Canadian Nurses Association, is also looking at developing our own materials and thinking about what are some of those tips and things that we can be providing along the way to support you. So please let us know and talk to us about that. So another thing is that we've seen an enormous amount of public outpouring of support and gratitude to nurses and to healthcare professionals, but also to some of those core service providers. So on one of the national CTV interviews that I did, I had the privilege of being beside, actually, Ellie, I think was her name, from the Yukon. And she was a grocery store worker. And so she was talking about her experience, how she prepared for work every day, and some of the things that she was doing, preparing and protecting herself and what their employers were doing. So we've seen a real outpouring, and I know that the Registered Nurses Association of Ontario is encouraging everyone to come out and to bang. I think it's at 7:30 every evening in sort of as a stand of solidarity and of cheering on. And on a personal note, I just saw an interview yesterday of my husband's aunt in Regina, and her name is Verna Betker, in seniors housing, and they're all out on their balconies at on Monday evening, I think it was at 7 o'clock, ringing bells and banging pots and cheering. And I noticed today that on April the 4th, I think it's Saturday, asking people to go out at 8:30 and sort of cheer and bang and be part of that solidarity across the country, but also around the world. And I think that as I read Verna's interview and listened to her on, I think she was on local radio in Regina, that outpouring of support and participating in that outpouring of support, I think, is a really, really important thing that we can do. So we're also very interested in you making your suggestions, providing some of your ideas around how we can do that together. So each week we are going to be focusing, we hope, on a different topic. We might repeat topics if people need to talk about it more. Related to COVID-19, we're hoping to have experts in the crowd with us, but also experts speaking and being part of our panel. So I'd encourage you to join us again for those, but also to provide us with some ideas about that. So Aidan, I think, or Josette, one of you was going to post a poll right now. We had a bit of a poll question, and then we're going to take a look at the questions right now. So I can see the poll, and what the poll says is, which topics would you like the Canadian Nurses Association to cover in future COVID-19 webinars? And again, if there are topics not listed below, those can be sent to webinars. There's an email address there, webinars@cna-aiic.ca. So it says that the host and the panelists cannot vote, but I think that means that you can vote. So if you could just take a minute there. And then I think somebody would, so it says mental health, it says personal protective equipment and supplies, talks about prevention and treatment, health human resource challenges, and are there others? So maybe as we're
Hi, Claire. This is Aidan. Thank you so much for that presentation, and thank you everyone for joining in with us as well. We're so happy to be able to engage with all of the nurses from across Canada on this issue. Before we move on to the discussion portion of this webinar, we'd like to ask you, and I see that many of you already have, to provide your feedback on the types of topics that we can cover. If you didn't have a chance to fill out the poll, you can also put it in the chat box as well. And we also want to move forward with the discussion portion of the webinar. If you haven't already, please type your questions into the Q&A text box, which you can bring up by hovering your mouse at the bottom of your screen and clicking on the Q&A button, and you'll find the box to type your questions at the bottom of that window. I also want to acknowledge, I know we are having some technical issues with participants not being able to speak to all attendees, but I can assure you we're getting all of your messages, and we'll be taking that feedback, and hopefully we'll have that sorted out for the next webinar. But we are getting all of that feedback in, so thank you so much. So I do see we have a few questions moving forward now. For those who have questions in French, please use the Q&A. I know that Josette is monitoring that for questions to respond. And if you're happy, Claire, we can move over to questions.
Sure, that'd be great, Aidan.
So we did have a couple questions that came in before the webinar started. The first question is related to the National Collaborating Centers. And so the participant wanted to know, how are the National Collaborating Centers involved in this current pandemic? And how could nurses use these centers in responding to this current situation?
So whoever asked that question, I'm going to say you're pretty darn smart, and I really like that question. So I'll just tell you what my day job is. So as of a year ago, I took the role as the scientific director for the National Collaborating Center for Determinants of Health. So I am involved and have been involved over a number of years with the National Collaborating Centers. So I'm just going to back up a little bit in the history, and then I'm going to answer that question. So when SARS occurred globally, but also in Canada, it really showed that our public health system really needed to be, I'm going to say, capacity built and shored up, if you will, in some ways. And there were a number of things that happened as a result and in the wake of SARS. One, and you'll be seeing her many times, is the development of the role of the Chief Public Health Officer, who is Dr. Teresa Tam. You can find her on social media. She's active on Twitter. So that was part of that structure. She also has an office and a team and supporting her, and I think doing a very solid job right now. Along with that were structures that help to link the public health departments, if you will, or organizations across the country. So I know many of you will be familiar with the Chief Public Health Officer in each one of your provinces and territories. And what's really interesting is they're really getting a lot of recognition. That may be something that we would like to have here on one of our next webinars. Maybe invite a couple of them to actually come and to be part of our conversation and speak directly to nurses in Canada. But there were structures put in place to help those chief public health officers across the country, chief medical officers of health across the country, to collaborate and work together and to be communicating. Because in a federation like ours, each province and territory has a different responsibility, and they are responsible for health service delivery in their jurisdiction. So that occurred post-SARS, and there were a number of other things. But another major thing was the development of 6 collaborating centers, national collaborating centers across Canada, and they go from coast to coast. So, and there's 6 of them, and they cover topics like ours, which is the determinants of health and is located in Antigonish, Nova Scotia, like healthy public policy and a very strong focus on health and all policy, whole of government, also on some of the ethical considerations in public health practice and in other practice. And they're hosted in Quebec by the INSQ in the province of Quebec. There's one at McMaster University in Hamilton, Ontario, that looks at methods and tools of knowledge translation. So how do we get the evidence that's there, whether it be research evidence, whether it be community knowledge and information, evidence from practitioners into the hands of the decision makers. And that's what the vision was for the collaborating centers. So there are methods and tools out of Hamilton, McMaster University. There's one here in Winnipeg focusing on infectious diseases. So the National Collaborating Center for Infectious Diseases, hosted by the University of Manitoba. And there's 2 in British Columbia, one hosted by, as I mentioned earlier, the BC CDC, part of the provincial public health system in British Columbia, and one hosted in Northern BC by the University of Northern BC. And they're focused on Indigenous health in the north at UNBC, and by BC CDC on environmental health. So those are the 6 centers, and we are all have active websites. We've all been in place for 15 years, and we're all very tuned into COVID-19. So please check our websites. I can speak for the determinants of health. We have a lot of resources there, very much focusing on equity and on health equity. I think there's a question there in the Q&A around disadvantaged and vulnerable populations and how to keep our site clearly on those populations and those people that we work with and that we care for and care about and provide services to. And we also hosted a webinar on just this past Wednesday on health equity. It's recorded and it'll be posted on health equity and COVID-19. I know that the NCC Infectious Diseases has a number of podcasts, in particular looking at stigma and COVID-19, also looking at some basic infection prevention and control, looking at, I did one for them on the role of nurses and how nurses could be used, if you will, as kind of the eyes and ears on the ground throughout our country. And it was a few weeks ago, so as we were anticipating that. But please use those collaborating centers. They were knowledge translation centers. We have a lot of networks, a lot of information. If we can do anything to support you, please ask us. And you can ask me through CNA if you want to get to the group of the collaborating centers. So thank you so much for that question.
Thank you, Claire. We also had a second question come in related to specifically to the masks and asking about how effective are homemade cloth masks that we are seeing happening mostly, south of the border from us.
So you provided me with the answer to that one. So I'm just going to look at my notes here. So there is a lot of reports, and I even had a friend of mine offering to sew homemade masks, if that was helpful. And so we are having increased reports about that, and people have inquired if cloth or homemade masks are acceptable for use. And if you look at the current guidance from Health Canada, it really says use extreme caution with homemade masks, as they're not regulated, they don't meet a particular standard, and they may not, and probably we should assume they will not be effective in blocking the virus or the droplet and the particles. So I think I would advise all of us to check with our organizations, with our provincial, territorial, public health experts, but I would use those masks with extreme caution.
Thanks, Claire. We have a question coming in from Patty Rodney asking, how can we best support nurses and other healthcare providers to deal with the moral distress and compassion fatigue that they're experiencing or might experience after this pandemic?
Hi, Patty. Hi, and thanks for being on there. And Patty, you were a very valuable contributor to our code of ethics as we refreshed that in 2017. I think that's a very, very important and a very real question. I did touch on the psychological well-being and the mental health of nurses, and you know, I think we need to think deeply about this. So Adrian and I had a conversation just before we got on this webinar that this may be a really important topic to have, perhaps even as early as next week about this. But I would encourage people to share their stories with us, to share some of their ideas about what might happen or might help, if you will. And I think what we need to do here is really anticipate the toll that this is going to take, and to think about how we might right away start to put in some of those supports now, but also into the future as we move along. You know, one of the things that I was thinking about is being able to ask for help. Being able to name what we're feeling, being able to actually say it out loud in a safe way and to a safe place. To acknowledge, we have an incredible elder on our board. Her name is Aline Flom, and she talked about that fear right now is a reasonable response, and to be able to think about it as a reasonable response. So that moral distress, I think we need to really be able to name it and ask for help around that. And I'm thinking that it would be a good topic for us to explore, perhaps in a deeper way, either next week or the week after.
Yeah, I completely agree. And I think we also have Mike here who wanted to add to that as well.
Thanks, Mike.
Hi, Mike, you're unmuted.
Yeah, you might have to take yourself off mute, Mike.
In the meantime, I think Mike is just working on the microphone, but there was a question specifically around vulnerable populations, which I think is really important, as you mentioned. And how do we continue to provide community services, or what strategies can we use to provide community services for our marginalized populations, or how can we support nurses in doing that?
Well, you know, thanks for that question, and I was really happy to see that question when it came in. And we're all members of communities, right? We all are part of our communities and part of the neighborhoods that we live in. So I think first thing is that we would think about those people, and that we would actually lift our voices as individual nurses or as a collective around those vulnerable populations. And I think also to reach out to our social services colleagues, right? Those that are in those services. And I think to support them to share what we know, to point them to some of the information that we have at the ready as nurses around personal protective equipment, but also around infection prevention and control, around some of the things that we're thinking about. So I would say a couple of things to advocate on their behalf, to talk to social services providers who are in contact with those populations, to lift their voices, to talk about the things that they're concerned about. And I would say, try to think of a couple of questions that as you're doing your planning, that would bring that equity dimension, that social determinants of health to your planning. So for example, who might this decision, whatever policy decision we might make, disproportionately affect a population, and what is that population? Another question might be, as you're planning, who are we not talking about or thinking about today that may be adversely impacted by this particular decision that we're making? And who else might we want to talk about or talk with so that we could actually bring that voice into our decision making on a day-to-day basis and on our planning? So I think those are some ways that we as nurses can also keep that whole, that holistic, and that equity and social justice perspective also in front and center for us. So Michael, I saw that you came off of mute. Looks like you're back on. Are you able to speak now? There we go.
Can you hear me, Claire?
Yes, I can. Yes,
oh,
Michael.
Brilliant. Hi, boss. Okay, I just wanted to add something, Claire, to Patty's question, if it's helpful, in terms of what we've been doing around advocacy, Patty and everyone on the phone. We started talking about the mental and emotional health concerns that were likely to arise almost from the get-go. And I wanted to, if it's reassuring to everyone on the phone, every call we've been on with every other group, it's one of their top 3 priorities. So it's come up over and over and over with employers, physicians, and so on. So in our lobbying, I just wanted you to know in very practical terms, here's some of the concerns. The mental health system is already hard to access, right? And crisis care can take ages. So how will we together manage what could be a big demand for PTSD services or just plain mental fatigue services in the short term, the medium term, and the long term? How will it be free? Because a lot of mental health you have to pay for. You got to pay for counselors, or you get 2 visits through your employer and you pay for the rest. So we were asking that it be funded. And the other piece that, Claire, I'm sorry, if you mentioned this earlier and I didn't hear, I'm sorry, because we were finagling trying to help with a technical issue, is that when this settles down, which it presumably eventually will, society will have a chance to have a breath and take a step back maybe, but nurses and doctors are going to be thrown right into this massive backlog of surgeries and canceled procedures. And, you know, hospitals are not, a lot of hospitals aren't doing much of that at all now. And they're going to go into it completely exhausted and be backed up for another year or 2. So we have spoken with the minister, with our physician colleagues, employer colleagues, and so on, and we'll continue to around how are we actually going to do this? And they all seem to agree it's necessary. What the steps will be, who knows, but it's very clearly on the radar. I just wanted you to know that, Patty. Thanks, Claire.
Thank you, Michael. There's a question here, Aidan, that I thought I might just try to answer, and it's about students. It's from Kristen, and she says, thank you for identifying the importance of supporting and thinking about recovery with regards to mental health of nurses. Has there also been any discussion about supporting and mitigating trauma, and considering recovery regarding Canadian nursing students whose educational journey has been impacted by COVID-19? And thank you, Kristen, for that question. And we did write a letter back to the health minister after I had a conversation. Actually, I think it's 2 weeks ago now. Time has gone very quickly. And I'm just going to read you what we said back to the Minister of Health, the Federal Minister of Health, and we can certainly make this available on our website, because I think this sort of advocacy or this awareness needs to be done at multiple levels. So students require sufficient support for safe, well-supervised, hands-on clinical practice and transition into the health system in the crucial months ahead. So students are uncertain, and we talked with the president of the Canadian Nursing Students Association, as well as with our Canadian Association of Schools of Nursing colleagues. So students are uncertain, as you're saying, Kristen, about the status of their practicum placements. They may be more certain now, but that they're not available to them. And for those in their final year, and whether and how a lack of those opportunities could affect their graduation. A consistent approach is what we were calling for across the country to their education. Deployment and payment is required, and it seems to be a bit different in the different jurisdictions across the country. They need strong orientation, guidance, and mentorship in order to enter stress teams and be able to practice safely. Nursing education is an essential service at this time. The Canadian Association of Schools of Nursing is well poised to assist in coordinating a consistent approach, and the Canadian Nursing Students Association is well connected with students studying in all streams across the country. So we're very interested, Kristen, in hearing your stories, hearing your questions around that, and we'll continue to advocate for that coordinated, consistent approach across the country, and to support our students and our future practitioners in our profession.
Thank you so much, Claire. And I know we're just going a bit over, and I see that we have, over 20 questions, and I can assure you that we're going to be taking all of the questions and comments back to our team to support and find answers for and respond to. So thank you everyone for for joining us today. And then we hope that you continue to join us in the webinars coming forward. Thank you, Claire, so much for being such a great leader and leading these conversations for nurses across the country. Before we end this webinar, we'd like to ask you to answer questions about the usefulness of today's webinar. So that should be coming up, that poll should be coming up shortly. And then we'll have to leave it at that, but we would like to thank everyone, and I'll leave the closing words to you there, Claire.
Okay, there's the poll. You can see there's just one simple question: how likely are you to use the information provided in this webinar today? But I'd really like to invite you to come back to continue. We'll leave the chat box open here for a few minutes. And Elizabeth is a wizard in getting all of that information off, and we'll collate it. But I just really want to thank everyone for coming today. We had more than 200 people register for this webinar. So there seems to be an interest. They came from all of the provinces and territories across the country. We will send this information back out to you. But I'm just going to repeat what I said this morning or earlier this afternoon. I have never been more proud to say that I am a nurse, and we are here for you at the Canadian Nurses Association. We want to support you in the coming weeks and in the coming months, so please engage with us. And we want our messages to be aligned with our jurisdictional partners, with our other national nursing organizations, and we're committed to that. So if you see that they're not aligned, we'd really like to know that. So I'm going to say thank you and farewell for today, and I'll see you again next Thursday at 12 noon Eastern time. So stay tuned and we'll see you again. Thank you so much. And thanks to the CNA team for your great support. Bye now.
Thanks everyone, take care.